Okay, I'm kind of new at this streaming live here. I tried to switch the orientation of my camera to face away from me, and that didn't work very well. So I think I might just need to sort of hold it like this. Jason Paul is setting up our sound system here. Anyway. Okay, so that answers that question that I am now I'm getting sound. I don't see you. Like, I see your camera is off, Joe, but I can hear you.
You can't hear me. Check the chat.
I can sort of hear you.
Check the chat. You can't see me. You're streaming.
Okay.
You're streaming.
Okay, great. I think I'm just gonna have.
You're okay. You're streaming.
Yes, great. I cannot. What happens every time I try to turn the orientation of my camera to face what will be our stage or our event, is it kicks me out of the stream. So I'm just gonna like manually hold my phone like this because I don't really want to get kicked out again. I've done it 2 times now, and it switching my camera orientation seems to boot me out of the stream. So yeah, so we're about 4 minutes away from starting our event, and we may be a couple of minutes getting started. But why don't I, impromptu, just invite Krista over, because Krista is the organizer here, and maybe she can tell us a little bit about why we're doing this event and what it came out.
Yeah, so over time, like the last 6 months, and I'm sure before that, there have been many groups. Really since last May, before last May, that's when Bernie Sanders reintroduced the Medicare for All bill into the Senate.
Check.
Groups and individuals have been asking our senators to co-sponsor Medicare for All. There's 14 senators right now that do, and it does not include Patty Murray or Maria Cantwell. I'm part of National Nurses United, and we recently delivered a petition of 500 signatures to both the senators' offices within the last couple of weeks, asking them to co-sponsor Medicare for All. So that's people from all across Washington state that signed asking them to co-sponsor. Also, we were part of a group early on in April that met with her staff, both Murray and Cantwell, separately, to ask them to please co-sponsor Medicare for All. We gave these great half-hour presentations full of all kinds of information, and they were very polite, but they basically said no, not at this time, and without a lot more information. Indivisible has been asking them. Seattle Indivisible, Visara, Puget Sound Advocates for Retirement, and many other groups. So it's just time that they do this, and that's why we're having the rally today to increase the pressure.
Okay, so we've got our music going, and it might make it a little bit harder for us to hear like our little interviews here, but we'll have some speakers going here pretty soon. So let me show you. So yeah, so we're here in Seattle. For those of you that don't know, we're out here outside of Patty Murray and Maria Cantwell's offices demanding that they co-sponsor the bill for Medicare for all. And I see that Andre, co-Washington campaign director, has arrived, and lots of other people. I don't know. I could get people to say a word, but I think people are going to say a few words when we get going with the stream. So we'll just see what Pam's getting ready to do with this flag. It's our red berets for Medicare for all. I'm trying to think, like, where, because the, yeah, we don't want to block the speakers. I don't know.
But you have bungee cord. It works great, you know, if you have a bungee cord.
Yeah, it would be really cool to have these,
We
like,
have some red electrical cables to use. Oh, like maybe between those two poles, that tree and pole.
yeah, let's do that. Well, we can do this one.
I don't know who this is.
Oh, that's all right. Yeah, I brought it for that purpose. Yeah, use it. Yep.
Okay, but I don't know if we can both sides. You know what I mean?
Oh, yeah. Go through there. Well, you're part of the setup, everyone. You're seeing us. Here, we gotta weave it.
To hold it. Hold one end.
Yeah.
All right, we can do that one after we come and finish. Got it? That's why I'm going to go around.
Yeah, I wish we had a bungee cord, darn it. Because this will look really cool.
But she's got a point though, like I could stand here every once in a while and hold it. It rotates. Yeah. We can roll it up and then when we're done getting out, we can pull it out again.
Okay. Well, timing wise, we had to start our live stream a little bit early here because of our generous host. Thank you, Joe Firestone, for. Oh, and it's Democracy. Oh my gosh, I'm forgetting the name of your new channel here. But anyway, thank you so much for hosting our, relatively quickly put together Medicare for All rally. We just figured it was a good time right before elections to try to utilize the pressure of upcoming elections and, let Senator Patty Murray know that her constituents, tens of thousands of them, have signed I-1471 for whole Washington. And here is Roxanne Thayer. Do you want to say anything on our live feed? We are live streaming this.
Wonderful.
You want to tell us about what you've done for I-1471 and what are you doing to educate voters who are signing 1471 about the privatization of Medicare? Do you want to tell us about that?
Oh, yes, certainly. Well, just recently, the New York Times, The Guardian, pretty much all the major newspapers have come out with information on the study done by the federal government, which shows beyond a shadow of a doubt that Medicare Advantage plans are both robbing the government and keeping people from accessing health care, and it's getting worse. So if you are on Medicare Advantage, get off of it. And yesterday or the day before, Ro Khanna and several other congressional folks submitted a bill to disallow Medicare Advantage plans from using the word Medicare because they have nothing to do with Medicare other than they're stealing billions of dollars from it. They can only call themselves Advantage because they don't serve you with Medicare. They serve you with an HMO. If you're on Medicare Advantage, you have co-pays, you have premiums, and you will be denied service. And if you'd like to hear Pramila Jayapal speak about that, you can go to Puget Sound Activists for Retirement Action and see her video where she talks about it, and then she introduces a gentleman who speaks about having been diagnosed with a melanoma while on Primera Medicare Advantage, and he was denied service, and took a year to get taken care of. By then it had gone systemic. So it's a dangerous thing to be on. Get off of Medicare Advantage. Go to traditional Medicare with a Medigap plan, and then your dental will be separate from that. You can speak to a state health insurance board advisor, and they will help you with that. But just remember, traditional Medicare with a Medigap plan. Good luck.
Thank you so much, Roxanne. Okay. All right. Hi. We have people showing up for the rally. We're doing a live stream before we're going to record everything on the live stream. Thanks for coming out today.
I'm not just a volunteer in Whole Washington, I'm one of the organizers of the Central Chapter of Whole Washington with Janet Young,
Thank you.
and I'm also the captain for the Central Chapter of Whole Washington.
Thank you so much. What was your name again?
Oscar.
Oscar. So nice to meet you. I'm Laura, and we'll get started on our live stream soon, but it's great to see you again.
You are absolutely beautiful and gorgeous and stunning inside out like you.
Thank you.
You can be my lady anytime I need that. That's from my heart and my soul. I don't say that to say that or like it. I'm serious. You can be my lady anytime. I'd be very lucky. I'd be a lucky human.
You are. Oh, look, we have people honking for healthcare already. Oh, this is like you do. What do I have? I have one that's got.
I can't seem to find my red beret.
You've got it somewhere, but I have another. If you'd like another, but I like your hat that you're wearing today. That's lovely.
But I can't find mine.
If you would like another one, hi.
Hi, do you have time to sign a petition? My rights were terminated with my son, and I'm trying to convince the family to let him call me because I thought I was being stalked, and I went to the police, and they thank you. They said I was schizophrenic for reaching.
Do I have to be a Seattle resident for this?
I can send mail to him, and I'm trying to give reasons why it's a good idea to let him call me. That's the big one.
Yeah, woohoo! Always good to see you, beautiful smile.
Hi, how are you?
Good. Always happy to see you.
Okay, I'm great.
Thank you.
Hi, Laura.
I'm hopping.
Hi, Joe. I see you now. I was sending hello. So we
Okay,
have a
I was able to start you streaming pretty much on time, but I had a problem with my camera.
Okay.
Okay, so I had to reboot my system, so that's not
okay.
going to come on. Okay, so I'm going to make you full screen now. Okay, and you will continue to stream.
Okay, perfect. And we'll see you back in half an hour or an hour or whenever that was. Something.
Probably a half an hour, yes.
Okay. I can't turn the orientation of my camera. So I think I just turn it physically, and that's okay. That's what I'll be doing.
Right.
But as host, I don't imagine that I'm going to do anything besides be holding this and aiming it at the speakers. So.
Okay, very good.
And I had said before, you probably heard me saying all this. Thank you so much for being our host today. And the name of your new show or program is Democracy. What is
the
it?
name of it, okay, is Empowering Democracy.
Empowering Democracy. Okay.
And that's our new channel, okay.
Yeah.
And Lisa is my co-host, but she's having some personal problems today, so she wasn't able to make it.
Yes. Well, that is certainly life and the life of activists and all of that. So.
Yes, it is active.
Thank you so much for hosting us. And like I said, I'm just going to be pretty much recording the speakers, and we appreciate you very much. I'm sure we'll be getting started soon. I see that Jason Call has the sound system all up, and people are showing up, and we're just kind of like setting our tables up so we can collect some signatures for I-1471. But obviously, the point of this event is we're going to be speaking to the demand for national improved Medicare for all. The fact that Senator Patty Murray is up for re-election, and she still, despite overwhelming support for this legislation from her constituents, still refuses to co-sponsor the Senate bill for Medicare for all. So that is going to be predominantly the focus. That's our call to action today, as well as Senator Maria Cantwell.
Yeah, Senator Cantwell as well. Okay, well, good luck, and I will be back in a little while. I'll give you the solo layout now.
Okay, thank you.
Okay, there you are. Bye.
Bye. Okay, so hopefully we're getting out with petitions. Do we have our petitions out for passers-by yet? Maybe I'll take just a second. So let me point something out here. Krista just said that she is with the national. Oh, I'm sorry, I'm talking to this camera. But I was going to point out that we're joined here by our nurses. This is our vice chair of Whole Washington, Catherine Lewandowski. Hello. Do you want to? I mean, you're going to be speaking. So, but anything preliminary that you want to say before we get started?
No, just I'm really excited to do this, and we're also going to try to have a mass emailing to that everybody in the nation can take part in, to email both Patty Murray's and
Maria Cantwell.
I did work last night, and it was very busy last night.
So busy.
And for people out of the States, if they fill out the form, they'll be able to email their senators with a personal email asking them to support Medicare for all, or if they do support Medicare for all, thanking them for that support.
Yeah.
So stay tuned for that.
Thank you. Thank you, Catherine. Hey. Hello. Yeah.
Signature, or we need signature.
Okay.
Thank you.
So, thank you. I will take that from you.
Thank you.
Thank you so much for signing.
And thank you for
Thank
doing
you.
it.
You guys have a second.
Would you like to get universal health care on the ballot in the state of Washington?
Take care.
Thank you.
You have fabulous health care.
Oh, look.
Hey,
So I didn't quite work out where they said they're from, but they're from a country.
tell her about healthcare in Norway.
Do you want to? We are live. Do you feel like saying?
We're live.
Yeah, we're on a
Okay,
live
hi.
stream. Would you tell us why we need to do this? Or where are you from?
From Norway.
Right.
Yeah, in Oslo.
Okay, so
I think if you compare how much the United States spends on healthcare, including public spending, it's I think you're at the top if you put those two together. We're probably second, but Norway is a very high cost country. So maybe Germany or the United Kingdom is more comparable for you, and they still spend, I think, less money on public money on.
So we must rate so much higher. We must rank so well on how our healthcare is compared to yours, right?
Well, maybe.
No,
I
we
think,
don't.
right?
We don't.
I think if you're extremely rich,
Right.
You might get better healthcare. But,
Correct.
Most people aren't.
No, that's right. Yeah, we lose 68,000 at least go have an early grave every single year in this country, and every 15 seconds an American goes medically bankrupt. So thank you for stopping.
Yeah,
Thanks for
good luck.
rooting us on,
Yeah,
and
good luck for,
yeah, have a good day. Bye. Okay. All right. Well, that's awesome.
It looks really cool. I love it.
I am wearing a doily. It's not a doily, but it's a Michelle. It's all hand crocheted. So a matching beret and a crocheted shawl by Michelle DeVilliers, which is beautiful. She's an amazing craftswoman. So now we've got some Medicare for All music on playing here by the Wick Lines, by Bob and I forget all of the Wick Lines names, but Must be starting pretty soon, guys. Medicare for all. Medicare for all. In the U.S. all the lights. Hi. Would you like to sign to help us get universal health care? Oh, thank you anyway. Have a great day. Not Washington voters. So while we're waiting to start.
I love and adore you.
I love and adore you.
You're my funny, you're my kind of lady too. You're sweet like me.
I am sometimes.
You're sweet like me to me.
Oh, this is a good time do you think we'll start, Jason?
I don't know, as soon as possible. Let's start right away.
Because I'm trying to create a live stream out of a pre-live stream. Do you have anything to say that you aren't going to say in your speech?
No, I'm going to say it all in my speech.
Okay, thank you.
When do people want to start? It's 11:14. You want to start in like 5 minutes?
I think we should start. I think we should start now. I think we should start really soon. Only because I have so much battery and I'd love to get all the speeches.
And is Matthew here yet? See him.
Well, you should go first to announce how this rally came about and say what prompted you to organize it. And it's not organized by the National Nurses, but it's on the backs of the work that yourself and your fellow NNU organizers did. To me, that's what I think. I would want to know the context of the rally.
Okay.
Those are my thoughts.
Okay.
But I'm not the MC. I think we're a casual rally today, and we're just hoping to connect with some of the passersby. And sometimes that's how it works in the movement. We show up, and sometimes we show up in great numbers.
Have Andre go first. You tell him after me.
Okay, I think we're getting started. And I think that we've got another live feed going that's for Facebook. So this is good. We'll be covered.
Check. Hey, let's get started. Please come on over and let's do our rally.
Woohoo!
My name is Krista, and I am with Washington. And we are here today because we want to see Senators Murray and Cantwell co-sponsor Medicare for All.
Woo!
A lot of people have worked very hard to make sure the Medicare for All bill got reintroduced into the Senate. Bernie Sanders reintroduced it last May. And even before then, many groups have been working on this bill for years and years and years. It's like near perfect now, okay? National Nurses United had meetings with Senators Cantwell and Murray. Well, not actually with them, but with their staff. And they gave the most beautiful presentations. People who have been working on single-payer health care for 5, 10, 20 years were in these meetings. And they gave very good presentations. And then we invited them to come and talk to us and let us know their answer at a Seattle Indivisible meeting. And what we got was basically, not right now. Maria Cantwell says that she supports changes and improvements in the Affordable Care Act.
Boo!
Well, I haven't seen very big changes. I'm just not very impressed by what's coming down the pike here.
Not at all.
I want a huge change. I want to see 66,000 Americans stop dying every year because they don't have affordable health care. It's ridiculous. Because we can afford it. This country can afford it. Anyhow, National Nurses Union also brought down within the last couple of weeks a petition to both Murray's office again, and Cantwell's office again. And I think they said they got 3 minutes with Murray's staff and 10 seconds with Cantwell's staff, who almost didn't open the door, even though they said they would take the petition. By the way, they're closed for the pandemic still. Did you know that? They didn't get the memo from Biden, I think. Pandemic's over. Anyhow, it strikes me as ironic that they are very well protected and safe up there in terms of their health, while the rest of us out here are going into medical debt, are not getting covered, are watching friends and loved ones lose their homes. So we're down here to say, please, co-sponsor Medicare for all. We will not rest until you do. And we will be very happy if you want to come down and tell us that you're going to co-sponsor the bill. Right now, I want to introduce Andre Stackhouse. He's the campaign director of of Whole Washington. Sorry. And he's going to tell us whatever he's going to tell us about why Whole Washington supports him. So he'll be right up here in just a minute. Andre, come on up.
Hello, everyone. Good morning, Senators Patty Murray and Maria Cantwell. Did you receive our invitation? Thank you. Did you receive our invitation? It's a shame you couldn't join us this morning. Every day is a good day to rally for healthcare justice.
Woo!
My name is Andre Stackhouse, and I'm one of your constituents and the campaign director of Whole Washington. And I'm here to deliver a message on behalf of more than 70,000 of Washington residents who you represent in Washington, D.C. Who are these 70,000 Washingtonians? Well, we have their names right here. This is a sheet for I-1471, and it contains 20 signatures to put universal single-payer health care onto the ballot so it can be made into law. In my garage and across the state, we have more than 3,500 bill sheets just like it. These are people you represent, and they want universal health care.
Woo! That's right.
So why do we have hundreds of volunteers exercising their First Amendment right of petition? Why have we gathered outside of your office this smoky October morning? Well, because the governments and politicians that represent us have left us at the mercy of a predatory medical industrial complex. Our healthcare system has left over 500,000 people in Washington state alone with no healthcare coverage at all. Our system puts us into medical debt when we can't afford it, and regularly is the top cause of bankruptcy, both in Washington and the United States as a whole. And according to a report in Scientific American, our healthcare system led to the preventable death of more than 330,000 people during the COVID pandemic. Now, we have a solution to this, and it's called Medicare for All. Bill number S4202, and it would fulfill many of the promises on your websites.
Woo!
Dramatically bring down premiums. This would take them to zero. Ensuring that everyone in this country can get health care without worrying about costs. Medicare for All covers everyone. Quote, making sure a change in jobs or a move across the country doesn't mean losing affordable health care. Medicare for All guarantees coverage regardless of your employment situation. Senator Murray, I know that you consider yourself a fierce champion of reproductive rights. Then you should know that even with the loss of Roe v. Wade, we have a way to ensure that nobody in this country has financial barriers to their reproductive care. It's called, wait for it, Medicare for All.
Woo! Woo!
Like you, we believe that, quote, we need an economy that works for everyone, not just those at the very top. How can we say we live in a country with a fair economy while our families and neighbors go bankrupt trying to receive life-saving care, while the CEOs of Aetna and Cigna are making salaries to the tune of $7 to $20 million a year? And yet we were told last April by the staffers of both your offices that you would not be co-sponsoring Medicare for All. Your reasons? You didn't tell us. Your universal health care proposal. We haven't seen them. We need action now in the form of National Improved Medicare for All.
Woo!
We need you to co-sponsor S4202. And if you believe that this is something best left to the states, well, then we need to know where you stand on whole Washington. Both of these proposals would cover each and every one of your constituents. So if you can't support them, then we need to know what the problem is.
Yes.
My office hours are 10:30 a.m. every Monday, and my email is andre.stackhouse@wholewashington.org. I would love to work with you on ending this humanitarian crisis in our country.
Woo!
You heard it, Senator Murray and Senator Cantwell. That's how you get a hold of the campaign director of Whole Washington. And he's willing to work with you, and we're willing to hear your yes. Also, Senator Murray, you say that you support Medicare. What kind of Medicare do you support? Do you support Medicare Advantage, or do you support Medicare? Currently, there's a bill in Congress to take away Advantage's right to use the word Medicare because it is not Medicare. And if you've read the New York Times or the report from the federal government, right now it's being proven beyond the shadow of a doubt that Advantage, not Medicare, is stealing billions of dollars from the Medicare Trust Fund. And at this point, you're moving towards complete privatization of Medicare, January 1st, 2023. That's just a few months away. We cannot afford to have our Medicare Trust Fund stolen by Wall Street. You need to stop that insanity and join with Pramila Jayapal and all of the other legislators in Congress to stop the complete privatization of Medicare and to actually support Medicare. Thank you.
Woo!
Just a little addition to that, Senator Cantwell, we've noticed on your website that it says you support innovative healthcare. We're just a little concerned that that might be privatization and ACO REACH, and we at Whole Washington are completely against that. Please stop those efforts for us now. Okay, next we're going to have Jason Cogg come up. Jason ran for Congress. State legislature. Congress.
I would have an office in this building.
He almost got an office in this building. I personally support him running again, but we'll see. He's going to come talk to us a little bit about corruption.
Fellow healthcare activists, my name is Jason Paul, and I'm a board member of Whole Washington, a former congressional candidate, and a lifelong progressive activist. And when I say lifelong, I'm actually back right where I engaged in my first protest. I remember camping in this very plaza in the summer of 1990 at the age of 19, when we gathered to petition our government to refrain from engaging in yet another immoral military adventure that would surely cost the lives of the innocent and enrich the weapons manufacturers. As is the case all too often, petitioning our government to do the right thing falls on deaf ears. And so I find myself on the steps of the federal building once again. How many dozens of times has it been since the summer over 32 years ago when we went to war in Iraq for the first time, but not the last? Here today again to fight for healthcare justice, because our plight, our pleas, and quite frankly, the common sense of single-payer economics are falling on deaf ears of our two United States Senators, Patty Murray and Maria Cantwell. When I was running for Congress in 2022 in Washington's 2nd District, where almost 32,000 voters voted for real change, It was against a 22-year incumbent, Rick Larson, a Democrat, who has said he'll never vote for a single-payer healthcare system without ever providing an explanation of why he won't support single-payer. He dodged the question every single time, preferring to talk, much like our senators, about supporting the grossly insufficient and hopelessly expensive ACA. So that's where I want to start with our senators. The Congressional Budget Office released a report in February of this year that showed a single-payer system would be more cost-effective and better serve the healthcare needs of Americans than the current privatized and for-profit system. A study released a few months later by the National Academy of Science. Do we believe in science in America? Do we believe in science in America? It indicated a single-payer system would have, as Andre mentioned, saved well over 300,000 lives throughout the ongoing COVID pandemic, as well as have saved over $105 billion in pandemic-related costs. In fact, that very same analysis showed that in a non-pandemic year, we would save over $438 billion on healthcare costs. And the most important thing, of course, would be that everyone would have health care. So I asked the senators, what is your objection to a single-payer system? Why will you not support Medicare for all? I want an answer to that question directly, not a dodge, nothing about supporting why you want us to strengthen the ACA, which is a terrible system. Why will you not support single payer? You've got some reasons. We just want to know what they are. When I have spoken about the failures of the for-profit health insurance system in the past, I've talked about my mother's death at the hands of the insurance industry. I have said everyone has a story of how they were harmed by the healthcare system through denial of services. This hit home again for me only just a couple of months ago. And this may come as a shock to some of my friends and fellow board members here because I haven't talked publicly about it, but it seems appropriate to do so now. In June, my wife was diagnosed with breast cancer. First, I want to say that she will be okay. I have good insurance through my employer. That good insurance is still leaving us with bills for the things that aren't covered, like genetic testing, so that we can decide whether she's going to have one or both breasts removed. She's already recovering from the first surgery, and the genetic testing will assist us with deciding whether to preemptively remove the other. These are weighty matters. This is not something you want to be fucking around with insurance companies about. But the genetic testing is not covered, and it is expensive. So here are some other things that we have countered on this recent journey experience with the health insurance system. As a candidate, had I made it past the primary instead of coming in a close third for the second time, I would not have been able to quit my job to campaign full-time because my employment is the source of our health care. You see, ironically, my wife works in health care, but she is a per diem worker and not on a full-time contract, even though she works full-time hours. So she has no benefits. Because she has no benefits, she also has no employer-based disability for post-surgery time off. And don't get me started on fighting the state for disability. Because she only had 11 months with her new employer, she wasn't covered under the Family Medical Leave Act. And to protect her job, she had to go back to work after 3 weeks recovery instead of the doctor recommended 6 to 8 weeks. And as you might imagine, post-mastectomy, it has been hard. She has another major surgery in January, but by then she'll have been with her employer for a year, so she'll be protected and she'll be able to get the healing time needed. Still no disability though. Also, prior to running for Congress, I was a high school math teacher for almost 20 years. This year, I was thinking about applying for teaching jobs again after being out of the system for 5 years. But all of the folks handling my wife's medical billing have advised us that changing health insurance in the middle of a major medical situation can delay or deny coverage and complicate treatment. So I didn't apply this year. We're hung up on our employment prospects by health insurance, by for-profit health insurance. So we can all count the ways, both big and small, that the for-profit health insurance industry negatively impacts our lives. But I'll be honest, my wife is lucky to have the insurance coverage that we have. Over a third of America has no or insufficient health insurance. And that includes over 400,000 people in Washington who have no health insurance. Anyone who has been through cancer diagnosis and treatment will tell you how important early detection is. Yet millions across the country, millions of women, don't have coverage or access to basic screenings. And according to the Susan G. Komen Institute, lack of health insurance is the #1 reason women don't get mammograms when they turn 50, when annual screenings become recommended. Let's be clear. The for-profit health insurance industry is both anti-woman and anti-poor. I'm going to refrain from excoriating our senators for taking campaign money from the for-profit health industry, which includes health insurance, pharmaceuticals, and other medical products, and for-profit hospitals and medical associations. Patty Murray, in particular, has taken a lot. What I'm going to do is appeal to the science, the economics, and the humanity. The Lancet, one of the world's most respected peer-reviewed journals, medical journals, celebrating its 200th anniversary next year even, published a study earlier this year, which didn't get nearly enough attention. They reviewed the privatization of the UK's National Health Service that took place from 2013 to 2020. And the UK has had Conservative Party leadership since 2010. And this study showed definitively the link between increased privatization of healthcare and preventable mortality. That is, the more healthcare is privatized, the more people die who didn't need to, who could have been effectively treated and lived. So when Krista talks about the privatization, the ACO REACH, Medicare Advantage, and the ACO REACH, and the Biden administration wanting to fully privatize Medicare at the beginning of 2023, that is what we're talking about. We're talking about increasing preventable mortality. We need to wrap our heads around that. Our government says privatizing industry is better. We don't care if more people die. That is the message that they are giving us. None of this makes sense. I'd like to live in a country where the headlines in the paper of record weren't telling us that children's hospital beds are being cut because they aren't profitable enough. Thank you. Solidarity.
Thank you so much, Jason, I think, for your personal story. Okay, now we're going to have Laura Fielding from the Red Berets come up and talk to us.
Just keep that orientation just like that, or don't move it.
Oh, you can see through here.
I can't. But I'm.
Hi, everyone. Thanks for coming out. So I have a shout out to one of the most amazing craftivists that I have the privilege of knowing, and that is to Michelle DeVilliers. I am wearing one of her hand crocheted berets and this red vest. What are the Red Berets? We are a creative coalition of dedicated people who use our creativity in many, many different ways. It started particularly, and our focus has been to pick up our knitting needles and our crochet hooks, but there are many people who contribute in so many other ways. As has been said, creating handmade signs is a form of craftivism. If you're wearing buttons, that's craftivism. if you are crafting your words and articulate the monstrosities that the corruption in our system and the politicians that are chained to this corrupt system, you are a craftivist. And I think what I think is the most important thing we can do, one of the most important things, is to be in solidarity and to be seen. So to create bold imagery allows us to get out there with this platform for the demand for national improved Medicare for all, that we join every developed country that guarantees healthcare as a right, and also to thread the needle between organizations that are acting locally to hold politicians and powerful people accountable, and people that are focusing always, every day, on the national front. These are interwoven and interconnected efforts. They are not separate. It's about being out and being seen and making these demands. And just standing there listening, when Andre came up and talked about having 70,000 constituents, I think about stitches in a beret, how many thousands of stitches, how many actions that we make. 70,000 signatures is a lot of work. These are constituents. These are Patty Murray and Maria Cantwell's constituents out. They have jobs, they have families. These are our nurses and us out making these demands, these pleas, using direct democracy. So I'm thankful. I'm thankful that there are people that are willing to get out and be visible and give their talents and their skill sets, because we, standing here in this coalition, and then those of you that are watching and involved in this fight, who are watching this live stream, we come from so many different backgrounds and we bring so many different talents and skill sets that we create a whole. We can create a unified fabric and make these demands. But yeah, it does boggle my mind to look at these two senators that we're particularly focusing on, our Washington senators, Senator Cantwell and Murray, who have not listened to 70,000 people that have signed to get universal health care to the ballot. When we tell volunteers who are out getting signatures for I-1471, hey, this is pretty easy. It's easy to get 20 signatures. People support this. That's true. Everyone knows this system is broken. But on the other hand, as everyone that's standing in this crowd that has collected signatures knows, it's actually a lot of work. Even 20 signatures, depending on where you're standing, there's certain events where there's just so many people that the signatures come easily. There's a lot of support. There's a lot of demand. But this is an enormous amount of work that has been put into I-1471 and the shoulders of previous campaigns with Whole Washington and other states that have run universal health care. It is a lot of work. It is a lot of putting our each foot forward and each step forward. And this is important that we come out and let our senators know that we ask the question very boldly: why are nurses and veterans for peace and school teachers and people of all different walks of life out doing the job that you are being paid to do? Now we're asking very clearly, Senator Patty Murray and Maria Cantwell, we need you. Your constituents need you and demand that you come along with us and support National Improved Medicare for All. Thank you very much. Okay. Krista, do you have someone following up here? Well, then I will be the person to introduce our next speaker, which is perfect. Our vice chair, the vice chair of Whole Washington, Catherine Lewandowski, RN, who is just an incredible volunteer activist. Thank you, Catherine. Laura.
thank everybody. I want to thank everybody for coming out today, and also everybody who's watching online. It's just awesome. My name is, and thank you so much, Krista, for organizing this rally. It is so important that we all support the health of our communities, and we all know that the goal is Medicare for all. Anyway, I want to say that my name is Catherine Landowski, and I am a registered nurse here in the state of Washington for the last 37 years. And I am also a volunteer and a board member for Whole Washington. We are a group of healthcare justice activists who have looked at the history of our healthcare system, and we are not satisfied with the status quo. We know that doing what we have been doing for the last 100 years has not produced the results that we deserve. What do we know about Patty Murray? She has continually argued that the ACA needs to be improved and that she does not support Medicare for all. Well, the only improvement it needs is to remove the for-profit companies who are profiting off of our healthcare dollars and offering no benefit to our health or our pocketbooks. Yes, the ACA decreased the number of uninsured people without health insurance, but it did so by making the majority of Americans pay way too much for their own health insurance. And by using our tax dollars to provide subsidies to those corporations with even more of our tax dollars, we lose, okay? I didn't finish that sentence. It was busy last night. I didn't get a chance to read it. Anyway, our elected officials have not been able to control the insatiable greed of the for-profit medical industrial complex. We all know that Medicare for all is what this country needs. It will save our country an estimated $750 billion a year. $750 billion that we can put back in your pockets, or we can put into climate change. We're going to have to do that. Anyway, okay. And yet, neither Senator Murray or Senator Cantwell will co-sponsor Medicare for all. There are 50 Republican senators who would never stand in support of Medicare for all. We must face it that the American people are not who they consider their first priority during their deliberations in Congress. Instead, they will continue to vote to protect the interests of their donors. With every vote, they hear cha-ching, cha-ching, cha-ching. And those same issues plague us at the state level also. Fortunately, though, our forefathers were wise, and they knew that there may come a time when the people would need to have a way to go around a state legislature that has been corrupted, a state legislature that may not be working in the best interest of the people any longer, but rather may be rewarding those same for-profit companies who share our healthcare premiums with our elected officials at every level. And with every hearing they deny, with every vote they delay, with every subsidy they deliver, what do they hear? Not the cries of their constituents. No, they hear cha-ching, cha-ching, cha-ching. But our forefathers gave us the gift of the ballot initiative. They rightfully foresaw times like these, and they gave us a way around so that the people could go forward in our fight for healthcare justice, and justice in healthcare, and justice in taxation, and justice everywhere. We have the power to give all of us what the rest of the developed world already has: healthcare. Please help us to get to 400,000 signatures for I-1471 by signing the initiative here today, and then go to yesOn1471.org or wholewashington.org and share it with everyone you know, because we can't do this with all the help and support that you can offer us over the next 2 months. And we can do this. I know that ballot initiatives have gotten a bad rep over the last few years. But in reality, the people of Washington have done a lot of good work through ballot initiatives. Back in 1977, the first time I was able to vote, we removed sales tax from food with a ballot initiative. We passed medical marijuana with a ballot initiative. And that was the last initiative that was won with all volunteer signature gatherers. We went on to win recreational marijuana through a ballot initiative. The city of SeaTac passed a minimum $15 an hour minimum wage. And look how that has been spreading around the country through a ballot initiative.
Woo!
We, the citizens of Washington, passed Death with Dignity. with a ballot initiative. Now, mind you, I love death with dignity. I think everybody needs that right. And when we pass I-1471, we will be passing for ourselves, our families, and our neighbors the promise of life, liberty, and the pursuit of happiness. What our country has promised us from its inception and what it has never delivered. We can deliver here in Washington State and then help it spread across the country as expanded and improved Medicare for all. Now, I want to ask you guys to do something that's very important. I would like you to please take out your phone if you can, or just make a note of this, and you can do it when you get home. But if you have a phone with data or a hotspot, I would like you to go to bit.ly/US4M4A. That will take you to an email petition, but it'll be like an email petition from you to your senators. Okay, and so if you're here in Washington, you can change the content of the email if you would like. I wrote it, so you're free to change it if you like. And then just send it off, and it'll go to our great senators, Senator Cantwell and Senator Murray. But then what I want you to do is I want you to share that with everybody you know on every social media platform. And when it goes out of state, when those people fill it out, it will go to their senators, okay? And if their senators have signed on, or one of the 14 co-sponsors, it will say, thank you very much for being a co-sponsor. And if they are not, it will say, damn it, we want Medicare for all. Well, I didn't say damn it. But
Well, it should. It should.
So please, everybody, do that. And over the next 24 hours, let's see how many emails we can send into the email boxes of our wonderful elected officials, Senator Cantwell and Senator Murray. Because, damn it, we deserve it.
Thank you, Catherine. That's Catherine Lewandowski, always telling it like it is. Our next speaker is Merle Adler, and he has another request for Senators Murray and Cantwell and a few other things to say. Come on up, Merle. And after this, we're going to have a little bit of an open mic, so if anybody wants to say anything, be thinking about it, and feel free to come on up and talk.
Patty, Maria,
Speak directly into the mic.
Get closer.
What?
There you go.
Am I doing okay? Oh, okay. Patty and Maria, I'm going to try to have you come down here and sign one of our petitions. I'll tell you, I've been to over 5,000 people in the past couple of months here, and have achieved pretty good response. 200 signatures isn't half bad. But I'll give you the appeal that I usually start off with. This could be long-winded, but take you a little bit of time to get down here and sign our petition. Please do. But I introduce myself as Merle Adler, and I say I'm receiving eligible for Medicare. I'm a vet. I get pretty good benefits by way of veteran benefits. People who are 200% or below the federal poverty level, or some disabled, get Medicaid. That's nice coverage. People who are government service workers get some pretty decent coverage in most cases. And what we would have by way of this initiative that I'm trying to give you trying to have you sign is something that we would describe as an improved Medicare. What is an improved Medicare? It is something that supplies us what truly is what people would describe as health services, and that would include dental, vision, hearing, a little bit for mental health. Very tough to get that mental health from your private for-profit provider. You have right now a situation, particularly in Seattle, where we do need some of that if you've been on any of our sidewalks. But I would like to see that we can improve upon what we currently have from your members of Congress back there in D.C., which is Obamacare. Obamacare was very good. Obamacare gave us a lot of people decent health insurance, but it is known as the Affordable Care Act. The Affordable Care Act had to trim different ways of cutting out certain hospitals. They tried to cut out children's hospitals over here beyond the hill. and they also are an operation that, to be affordable, is having to create doctors' networks and places where it's actually ending up leaving us with 400,000 people without any insurance at all. We have 3 times that who have very inadequate health insurance. That's 1/4 of the population of our state here. They could definitely use something that you could sign on to right now. I'll give you an example of what we have. We have an economy now where pre-COVID we had 62% of our businesses are primarily failing due to medical bills. The 50% of our foreclosures and evictions are primarily due to medical bills. If that doesn't cause some unevenness in the kind of health that we can expect from people, we can look at the kind of problems that you do have with any of these things that we really do need to cover not only their problems with continuing on in the marketplace. We need something that we can pay for. The way we would pay for our medical system if we got universal health care on the ballot would be what we describe as a contribution by the state funds to appropriate something for the continuing ongoing parts of this, like any other program that we have going on. We would have a donation of 10% from businesses, just like in Social Security, where you have a match of 10.6 to an employee's match of 10.6. We have one where it's 10% for the employer to provide. And since employers really are very rarely supplying any health insurance whatsoever, you really have to shop. You're going from a business to as an employer or as you know, you really have a tough time even providing for yourself your own health insurance, and that would be something where we believe that 10% is reasonable, because in the past we've found that this would put in an investment in avoiding those foreclosures, or those help to avoid those foreclosures and the business failures. What we do have is different programs that are provided by to help out in general. We have included in this is health, reproductive health services. Right now, in our state, we're not directly affected by the recent passage of Roe versus Wade, which perhaps people in D.C. should have codified at that national level. But 27 states will likely have the right to be taken off of measures that they ordinarily would have an access to. Here in our state, we do have a right, a codified right to a woman's right to choose. But with these services in our state, if we were to pass this initiative, would be getting not only the right, but we would have a free right. And so what does this technically mean? It means that a woman now might have to go to her sugar mom. A woman now might have to go to Daddy Warbucks, or say an uncle. They might have to be going to some of their friends to share in a personal decision that maybe should only be decided upon in confidentiality with a doctor. What our health care system here would do is be just like any other most developed modern country. We would be able to go into any hospital, go to any doctor, and what that doctor says is what we'd be able to give. So, in specific instance of a woman in a family way, we'll describe it, may not be possible in a family way. You would be having the confidentiality of the doctor to perhaps make what would be a more sane and personally reasonable decision. Also, look at the pandemics. Say 100 years from now we had a pandemic. Well, hey, we've got one right now. But it means for this situation of a pandemic is that when the pandemic first started out, we had 4% of the globe's population and being affected by 25% of the COVID deaths. By way of that, what we currently have is people who right now can't afford any kind of health insurance or having to be owing their doctors some services of this sort, have that paid for. The incident is that you'll perhaps have a case where, say, a person gets a sore throat, a person gets a runny nose, gets a fever. In that instance, they might be even tested. They might find that they decide to hold out because they think that maybe they only have a cold, and maybe they'll tide over. Maybe the next test they have is going to be one that it's something that'll carry them on to go into that hospital and get a laboratory test. But what we need to be having, though, is some system where, like the rest of the most developed countries who have succeeded in treating the infection, we'll call it, much better, is that you are able to go directly into that facility and get immediate attention. And that duration of time when you're trying to wait for testing positive, you're spreading the infection. You're doing something that is increasing the amount of money that's spilled out to our healthcare benefits. The Scientific American just recently came up with the fact that a couple of months ago that we just pressed it over a million deaths in the U.S. That 1/3 of those deaths would have been saved. That we would have those people with us here today had they have had an adequate health insurance. I'd just like to say that we'd like to see you sign our petition, and if you're able to, come right out here. We're down here. Follow the instructions here. You sign your printed name, your signature, your street address, your city, your zip, and county, and you're done. You supported our situation here in needing some health care that is sorely needed by over a quarter, very much needed by over a quarter of our population. So, thank you very much for your signature. Should you give it?
Yay! So much. Oh my goodness. The folks that are here today have been in this fight that I can't say enough good things about for organizing here today. The people that are, hey, that's better. I cannot say enough good things about the people that are here today. There's so much heart, energy, and fire, and resilience, and tenacity with this group of individuals here today. Right? Yes. Some of us drove 2 hours to be here today. This is an incredible, urgent issue, and I do not think it's receiving the kind of urgency that it deserves. We've seen with the pandemic that healthcare tied to employment is an incredible flaw, one we've been dealing with for far too long. We've seen with the pandemic that the insurance companies are going to keep all the money. If we just don't go to the doctor because we can't, they're just going to keep all that money, all of our money. They're just going to keep it. But we need to get them out of the system. They're absolute parasites on the system. There's no nice way to say that. So I've been a nurse for over 20 years. I've worked in lots of different arenas with nursing, and in every situation I've seen patients who've had to ration their medication. In every situation I've seen patients who had to go without because they couldn't afford it. In every situation I've worked in as a nurse, I've seen patients who delayed seeking care because they were afraid of the cost. They were afraid to be a burden financially on their families, and that's just not okay. It's just not okay. Now is the time to end the suffering of ourselves and our country and our state, and now is the time that our senators act with some urgency and some courage, like we've seen from them before. I can remember my dad has talked about Patty Murray and her tennis shoes my entire life. He's talked about how people told her that she couldn't. She took her damn shoes and she went to the streets and she got it done, and that's what we're here for today. I still think that Patty is in there. I know that my dad put his trust in Patty Murray because she is a mom in tennis shoes at heart, and that is me. That is all of us here today
as the nurses that are driving this movement, we are all here to get it done. So
Yes.
let's get it done.
Woo! Thank you, Carrie. Woo!
Thank you, Carrie. Now Ashna would like to come up and make a couple of comments, and then anybody else who would like to come up, that's fine too.
Good afternoon, everybody. Thank you for being brave and bold enough to not only accept me as an intersex person and allow me to be a normal young girl as much as I can be, but I have a message for Patty Murray and Cantwell and those that continue to deny and not allow us intersex folks in our bodies to be girls and women's bodies and continue to deny us our reproductive freedom and our abortion rights and our health care that is appropriate for us. We should not be forced to be given treatment that is for trans people when we're intersexed. That is not right. That needs to end. You need to be brave and bold and give us intersex folks the proper treatment and health care that we finally deserve.
I think that is concluding our live stream. Thank you very much for joining today. And thank you, Joe, for Firestone, for hosting us on this channel. If those of you who do live in Washington State want to call Senator Patty Murray and Cantwell, give them your requests for them to co-sponsor Medicare for All in the Senate.
Okay, so just to say a word, I think that was a wonderful stream. I wasn't able to do much commentary on it because I had a command performance somewhere else at the time. But before I end the stream, I want to say a thank you to Laura Fielding for doing the streaming. Of course, that's how we got to see the wonderful speeches, and that's how we got to hear the wonderful words, okay, of all the speakers. Okay, I want to say thanks to Whole Washington for this stream also. They were the organizers of this, of course. And I want to say thank you again to Laura Fielding, because I know she was part of the organizational group and did a great job, okay, in organizing this. So for those of you who have seen this as a live stream, and unfortunately there weren't really too many people, okay, who did that, we will be on again shortly, and we will replay this stream. It was a very important stream, and I think there's a good chance that Lisa Theobald and I will want to play it again and do a commentary on this stream, perhaps even tonight. But if not then certainly very soon. So for those of you who have come, thank you for coming. I hope you want to sit through things again to see our commentary when we do that particular commentary. So thank you again for coming. There'll be more from me and more from Empowering Democracy very soon. I hope that you'll come for those streams as well. We are a new channel. We're about empowering democracy. We have a Patreon account at patreon.com Joe Firestone. We also have a Buy Me a Coffee account as well, and I'll put the Buy Me a Coffee account up there for just a second so you can see that as well. So once again, thank you for coming, and we'll see you soon on Empowering Democracy. Good afternoon, everybody.